So I'm Rachael. I'm one of the senior nurses in the surgical department. I've been here since ERH started, but before that I worked in one of the GP clinics and had done for a number of years. So in the surgical department, we do varied amounts of procedures, working with a lot of specialist vets. Every day is a different day. It sort of keeps us on our toes and makes coming to work a fun thing too. Working in GP, I'd spent a lot of time on reception, and for a number of years I'd wanted to get into surgical nursing. One of the owners of the organisation came and started doing an orthopaedic day, which happened to be my surgery day there. So we did a lot of the sort of stuff that we were doing here in a GP setting. And then when this building was built, obviously we all still had to apply for roles. But I was lucky enough to be able to come and join the surgery department here. A lot of that's changed over the years, and we've had lots of different specialists come on board, and our team has grown immensely. But what we were doing there is relatively similar. It was just on a smaller scale. I'd never looked at job progression, but it's certainly something that's happened with being here, and I think as the team has grown, we've needed more structure. Yeah, so an opportunity came up for me to be one of the senior nurses, which I applied for, and it's really been something that's made me thrive in my job. It's given me a new lease on coming to work, and I've certainly enjoyed helping, run the team each day. It's been lots of fun. A lot of the nurses in the team all have varied abilities. So it's my job to, nurture the junior nurses and train them up in their skills. And it's my job to help the surgeon keep the surgical day running. So we look at the procedures that we've got to get throughout the day and keep the ball rolling to get one patient through when the next one started. My personal experience, I'm not the most confident nurse, so the managers and the team leaders within our practice have helped me believe in myself, which has drawn out a bit more confidence that I probably would have held back on previously. Certainly not having had the skills that I felt I may have needed for a specialty clinic. But I've really enjoyed growing as the team's gotten bigger, I guess, over the years. I think I draw my confidence from the varied levels of resources that we have amongst the team. We can turn to a team leader if we've got any difficulties. A bonus with our anaesthetics is that we have an anaesthetic specialist that comes into the building and works with us. So rather than us going through those tricky procedures on our own, she works alongside us and supports us and guides us with any difficulties that we come across throughout that. I also find that if there's something that I hit a hurdle with throughout my day, we've got some online videos and information that we can go back to, and that's something that if I feel I need to learn a little bit more about, that I can go home and read up on it and come back and ask any of my other fellow nurses. Everyone's really good at being there to support, and my team leader's been really helpful too, to kind of nut those issues out so you're not on your own. I quite enjoy the ones that come in unwell. It's not nice to see them sick, but it's certainly nice to be able to have a hands-on team effort, help those patients, and then watch them trot out the front door, and how overjoyed their owners are at seeing them well again and up and walking. Tugs on the heartstring. Everyone's really good at looking out for each other. So if you've been through a really hard case that can sometimes overwhelm you or upset you, we can turn to each other. Often in some of the more critical ones, we sort of have a team meeting and have a chat, check in with everyone. And they do have a counselling service that we have access to as well. So if we really are struggling, there's that we can call upon, but generally a chat with each other. It's a huge team, but I think everyone's really welcoming. As I said, I lack in confidence. And I think the fact that everyone helps each other out, all of the departments all mingle with each other, We have some out-of-work activities that it's always nice to see people outside of work and get to know them a little bit better. But I just enjoy the environment, and I like the varied things that we see here. No 2 days are the same. They're all really different. So you never know what you're coming in for. But I often will stand back and go, wow, like, how am I here? It was never something that I had looked at back in GP. And sometimes it's almost a pinch yourself moment that, I get to work in this setting with some pretty amazing people. I think the bonus here is that there are the varied departments. So there's always room to move. You can come and try the surgery department. We've got medicine and ECC. There's multiple GP clinics, and I think in a big organisation it gives you the room to move. So rather than being stuck in that one position, if you gave something a try and you didn't enjoy it, then there's that option to move from one department to the next, try GP, or look at something managerial if that's where you're wanting to take your role.